Hello everyone, this is Dr. Aditya Sibi Chakravarti here. It's been almost a year since we posted in this channel. From here on, we'll try to post at least one video a week. So the topic of today's discussion is that why I chose cardiology as my super specialty course over other subjects. Okay, when I wrote my exams, a lot of my seniors were like telling that don't choose cardiology as your super specialty. The reasons being that it is super saturated in cities and you don't have good scope there everywhere. Like every year, a lot of cardiologists are coming out, and it's cutthroat competition out there. So they advise me to kind of choose other subjects over cardiology. But I still went ahead and chose cardiology, and I will tell you why in this video. The first reason I chose cardiology was that I loved the subject. Ever since my undergraduation days, my interest towards cardiology was always there. I read cardiology extensively in an undergraduate for an undergraduate standard. I read cardiology extensively, and even during my post graduation period, whenever a cardiac case comes to my casualty, I will be interested to go and see it. I mean, I had a particular affection towards the MI patients or arrhythmia patients over other patients. I kind of had an interest there. So I thought, like, since I'm interested towards it, like, let's go to cardiology. That was my first reason. The second reason why I chose cardiology was that it was an interventional branch. In when I was doing my MD in medicine, surgery people used to come and boast that I've done this surgery, I've done that surgery, that they used to kind of boast it. Like I felt like we are not doing that intervention. That was something that was in my mind always, and that is one reason why I chose cardiology, because it being an interventional branch. And interventions in cardiology are too much here. I'm doing from Jayadeva, and we have such a huge volume of patients here, and it's the largest center in India. Every day, every cath lab, we end up doing 5-6 plasties, and it's just not coronaries. There are a lot of other interventions which the cardiologists do. Like you can do structural interventions like ASD, VSD, PDA, or you can go for valve replacements, and mitral valve replacements are also coming up. And a lot of devices like pacemakers are done, single chamber, double chamber. And it's not just cardiac, it's a lot of extra cardiac things are also happening. People are going for carotid stenting, renal artery stenting, and peripheral interventions, like whatnot. Like every single vessel is being intervened by cardiologists here. So the scope of intervention is huge, and it's growing at an enormous pace. So I recently have attended the India Live conference, and so much thing is happening in India as well as in cardiology. So it's definitely a field which is growing at a huge pace, and it will continue to grow over the next 20, 30 years. That's the second reason. The third reason why I chose cardiology is that, okay, if you don't even do intervention, there is a scope called non-interventional cardiology. ECGs, echos, TMTs, and a lot of preventive cardiology patients, like namely heart failure patients, coronary artery disease patients, hypertensive patients. That's a huge volume of these patients, and they are present in huge number. Valvular heart disease in India, it's definitely still huge. So these patients, even if you don't do interventions, you will still have a huge volume of case to treat. And echocardiogram, just like you will be practicing like a radiologist, you'll go. And the other reason why I chose cardiology is that it is always exciting. There is no dull day in cardiology. You cannot relax. We won't be bored. Definitely, you won't be bored in cardiology, because every day a new complication you see, a new things you see, and it just keeps growing and growing. So you'll always be, and even you will always be interested. You will have to be energetic in cardiology. It's one specialty which requires a lot of energy from your part. So that excitement is there definitely. The other reason why I chose cardiology was that the results it gave. It is very effective. A patient coming to us crying in pain, or an arrhythmia patient coming almost collapsing. You do an intervention, you do a procedure, and patient, he becomes, at the time he discharges, we add some effective quality life years to his life. In the most of the diseases have very effective treatment, and it's not like some other specialties where when you do something, the patient's life is always in a downward course. You just slow the course. Here it's more like you tend to add some effective life years to the patients. Even the chronic condition like a heart failure, the patients have definitely a better quality of life than many other organ failures. So and you have new treatments coming every day, so many trials coming every day, and everything is scientifically data proven. So, and other thing is that financial rewards. Again, any intervention, you're going to have some financial rewards in comparison to non-interventions. So coronary artery disease is not coming down in India. It's prevalent in any part and every part of India. Summing up why I chose cardiology, the first reason was that I loved the subject. Second reason was that there is a huge volume of patients, of coronary cardiac patients in India. Third reason is that there is an effective treatment for almost all the patients, and you can add effective quality life in that patients. Fourth reason is that it's an intervention specialty. It is a growing specialty, and it is one that is 10 years from now, the specialty would be having a different phase. We'll entering other organs also, not just cardiac. We are intervening other organ systems also. So it's a one that has definitely a big scope. So these are the reasons why I chose cardiology over other specialties.